One. Next up, we have some preliminary results from a pilot study the Global Wellness Initiative exploring salt and halotherapy are doing. I'd like to welcome Chairman Steve Spiro to tell us a little bit more about himself and what they've been up to. Welcome, Steve.
Thanks, Aaron, for this opportunity. For those that don't know, the Global Wellness Institute is one of the leading nonprofit organizations whose mission is to empower wellness worldwide by educating the public and private sectors about preventative health and wellness. It's organized into about 35 different initiatives covering a wide range of wellness subjects. One of the main ones is the Halotherapy initiative, which I am chairman of, and we're lucky to have Aaron and Beata also part of the initiative. As part of our plans each quarter, we look at key things to focus on. And obviously with COVID, there are over 250 million global cases. And in the US alone, there's 50 million cases. In terms of long COVID, it's estimated anywhere between 25 and 50% of the people have had long COVID. And we just were hoping and wanted to do some research to see if the respiratory disease of COVID could be treated with halotherapy, a great respiratory modality. So we've recently begun a pilot study, and I'm going to have Beata talk about some of the preliminary results.
Hi, I'm Beata Jurava. I'm located in Vancouver, British Columbia, Canada. I'm the owner of Breezold Wellness, where we treat respiratory care, or at least boost your health in your respiratory lung capacity. We have clients and patients with issues such as bronchitis, asthma, allergies, infections, and etc. We have clients as young as newborn babies and as old as elderly. I'm also a strategic consultant, and I got a degree in business in Canada. I have been working and doing some research on my own on respiratory care over last 5 years. And I have gained quite significant knowledge coming from Europe. I'm a European, and in Slovakia, we have over 1,000 natural caves. And many of the practitioners, medical practitioners, are sending their patients to natural caves for additional respiratory wellness. I have gained further knowledge from participating, and I was fortunate enough here in British Columbia to cross sharing the data with multiple medical practitioners, scientists, medical engineers, ER nurses that are working with us as well. We have naturopathic practitioners, and we collaterally working in multiple vitality wellness for people. I'm also an owner of Vitality Wellness World located in British Columbia, where we have patients trying to get their vitality up to beat, really, as for cellular rehabilitation. And we are testing their hormonal testing, toxicity level, what they have in their body. We do live blood analysis, dried blood analysis, as well as we do respiratory check and their status. Let's just deep dive pilot project for this 15. We deliberately selected 15 people over the last 4 weeks pilot project, just so we can see how and what protocols we should be using. The key measurements we have selected was peak flow, sitting and hold breath test, oximeter reading, blood pressure, heart rate monitoring, and their feedback from participants. Well, let's just go into what does it mean long COVID symptoms. Long COVID is used to describe signs and symptoms that last for longer than 4 weeks after getting COVID-19. It can affect your whole body, and your symptoms can change and come and go over time. Mainly what I have noticed from clients and patients coming to our clinics was they had been experiencing certain level of brain fog, a lot of headaches, cough and sore throat, breathlessness, chest pain, and a lot of pains and aches in their body. The protocol for pilot study, well, we have selected people and pilot people approached via existing facilities that are currently using halotherapy treatments with the halogenator machines that grind the salt, pure NaCl, inside the room that disperse the little particles, and you happen to breathe the dry salt therapy. They were informed about the process and follow a specific guidelines and protocols. We also explained to them that we are testing them over this period of time on a weekly basis and on a daily basis. Weekly means that they would come to our clinics or the respiratory centers and have their 1 time a week salt treatment. We would then also measure their status of based on a peak flow. Peak flow would be how quickly you breathe, exhale the air out of your lungs. The blood pressure, oxygen level, breath test, temperature, which obviously it's part of the COVID precaution. And also we asked them to purchase Halo Pocket that we suggested for them to use in daily basis, 2 to 3 times a day for about 5 to 10 minutes. Each person also have purchased Halo Pocket device. Again, we tend to all have it. I also have it at home. Our clients are using it as well. We actually have a list of multiple people requesting it as a back order. So I'm really looking forward to put this into a Canadian market. Well, let's talk about some of the results. As we can see, the average peak flow change over the last 4 weeks. Let's just talk about the graph that we see in front of us. We see a range between 370 to 460 liters per minute. And over a period of time, 1 to 4 weeks, we do see significant improvement, about 12.5% of positive results that people have increased the measurements from liter per minute to all the way to 450. So if we keep doing these for another 4 to 8 weeks, we should be seeing more further improvement. The holding breath test. The holding breath test means that you are calmly sitting on a chair about 5 minutes, and then you would perform this testing. You breathe the air in and and blow the air out and hold the breath. At that point, when you stop breathing or moving, you will start recording the seconds. When we have started initially, the results of all the participants average in about 18 seconds they were able to hold the breath. After 4 weeks, look at that, we have 119% results in close to 40 seconds holding an ability to hold the breath. That's fairly significant. I'd love to see what's going to happen in about 8 weeks, but the healthy lungs means that you achieve having ability to hold the breath between 40 to 60 seconds. These are qualitative data. This is what participants were telling us. This is their feedback to us. The results were, well, I can breathe easier. There's more phlegm coming, but I'm less anxious. Phlegm is clearer looking. So yes, people will be having a lot of sneezing, coughing out, or phlegms coming out. That is a good sign, but it's clearer, right? The long COVID symptoms have become less noticeable, less fatigue, and less coughing. Well, what will be our next stage for the pilot study? Well, we wish to transition from stage 1 to stage 2 of the pilot study, and we will be streamlining a protocol to include only 3 key quantitative measurements and 1 key qualitative data, which we're still getting the participant feedbacks. We'll be using peak flow, we'll be using spirometer, sitting breath hold test, and again, we'll keep participation feedback. The standard recording forms and all the information that are going to be given to facilities will be up to them to monitor as is needed. Let's just talk about some benefits. Go ahead, Steve.
Steve, sorry, you're on mute.
Okay. First, Beata, thank you very, very much. I talked to a lot of salt therapy places over the last 6 to 9 months, and I've gotten a lot of kind of casual anecdotal feedback that halotherapy has been helping their long COVID patients, but seeing some, firsthand primary data is great. And I'm really excited about moving forward with additional data with more facilities. So from a salt therapy perspective, our goal is really to make your facility or salt therapy facilities in your community become the wellness center where people go to get, preventative or, post-COVID kind of assistance. So we want to bring new people to your facility. We want you to be able to make more money selling Halo Pockets. And as Aaron said, it's actually, helping more people get into the halotherapy and still coming to your facilities. Most importantly, we want healthier customers. We want repeat customers and encourage commitment to halotherapy. And we want you to be able to provide insightful data back to your clients. So this is lots and lots of benefits to the industry. Stage 2, which are going to be starting around January 15th, we're looking for another 20 to 30 facilities to take part using the same set protocol that we've developed, going after those 3 quantitative and qualitative using the Halo Pocket and coming into your facility once a week. We want the stage 2 to kind of confirm, ideally, the primary collected data we have so far in stage 1. We really want to better understand through the stage 2 of the pilot study how we go into a much, much larger and broader phase 1 study, which hopefully will be around March or April. And we've already started to talk to and engage scientists and medical professionals interested in recognizing the benefits of halotherapy. That's been one of the frustrations in the industry, that we really haven't been able to get, the scientific community. But we think with data, this will help you with your business, and we think it will help greatly with the awareness and acceptance of the great halotherapy modality. So basically, it's real simple. If you want to participate in stage 2 of this pilot study, we're looking for 20 to 30 facilities to do research on about 5 to 10 different clients of yours. Please reach out to me at steve@halotherapysolutions.com. Try to do it as soon as possible because we'd like to launch this mid-January. So again, Beata and Aaron, thank you so much for the time. We're really excited about the first results helping people with long COVID through halotherapy. So this is great. Thank you.
Great. Thanks very much, Steve and Beata, for joining today. As you just said, Steve, I'm also very excited about the prospects that this may have for the halotherapy industry, and the WHA is very excited to be a part of all of it. So